In Pennsylvania, we have a mental health crisis. A 2025 report from the National Alliance on Mental Illness stated that 1 in 5 adults in PA experiences mental illness each year. This is more than the national average of 1 in 20 adults. 1 in 9 teens aged 12 through 17 have serious thoughts of suicide each year. That's roughly 127,000 PA teens who have had serious thoughts of suicide each year. 2,352,000 adults in PA have a mental health condition. That's more than 7 times the population of Pittsburgh. More than 850,000 people in PA live in a community without enough mental health professionals. And between 2018 and 2019, 681,000 adults in PA reported needing mental health treatment, but did not receive it, stating cost as a prevailing factor in not receiving treatment. Hi, my name is Keith Briner, and I'm a social work practitioner and Christian minister. I am seeing a resource in my community that historically has been underutilized, undermotivated, and underprepared to meet and address the needs of those individuals and families suffering from mental health challenges. That resource is the Christian church. Though this trend is beginning to change, there's still a long ways to go. And I believe that social workers who are faithful followers of Jesus can help lead the way in calling the church to care for and to be a voice for those who many times do not have a voice. As a social worker, I've seen the importance of addressing complex issues across multiple systems. In the case of mental health challenges and the role of the church, I'm not only forced to look on the micro level, where I'm counseling a mother in the pew whose adult son is currently on the streets and struggling with schizophrenia, but also on the meso level, where I'm helping the son and his family navigate the system by connecting him with local mental health services while being involved in a task force to encourage more interprofessional collaboration between agencies that many times are competing for dwindling resources that include federal and state funding. All this while keeping up to date on and advocating for policies and legislation on the macro level to help make sure access to these services are equitable and available to the most marginalized. One such macro level issue that is of concern in PA, as well as nationwide, is highlighted in the 2025 National Alliance on Mental Illness study. The study states that PA residents are 5 times more likely to be forced out of network for mental health care than for primary medical care. This is an issue that continues to be addressed through the 2008 Mental Health Parity and Addiction Equity Act. According to an official government website, cms.gov, the Mental Health Parity and Addiction Equity Act of 2008 is a federal law that generally prevents group health plans and health insurance issuers that provide mental health or substance use disorder benefits from imposing less favorable benefit limitations on those benefits than on medical/surgical benefits. Though this is a great first step, there are still various issues, according to the National Library of Medicine report, factors affecting state-level enforcement of federal Mental Health Parity and Addiction Equity Act, a cross-case analysis of 4 states that address gaps in enforcement, ghost networks, and denies claims that social workers and those in the church can bring to their legislators to continue advocating for those, especially with chronic mental health challenges, who need ongoing care and treatment. As social workers, our responsibilities have a common thread that is held together by the helping process, and that includes engagement, assessment, planning, intervention, evaluation, termination, sustainability. Examples of ways that we can utilize processes in the church at the micro, meso, and macro levels are through counseling individuals and families, developing support groups and trainings like mental health first aid in our local congregations, and addressing our local congressmen on supporting policies and legislation that provide more equitable access to mental health resources. At the same time, the National Association of Social Workers Code of Ethics in Section 1 provides us with a framework that aligns with our Christian faith as we recognize and honor the dignity and agency of every person and move beyond charity and mercy as we organize to do justice. So whether we're on a church staff as a congregational social worker or staff pastor, or if we are a layman serving as a volunteer, social workers have a unique opportunity to share the love and hope of Jesus Christ by engaging their faith community and addressing the mental health crisis right here in PA. Who knows? Maybe this is your call for such a time as this.